Good morning, everyone. We're just waiting for people to come out of the waiting room. We've got one or two more still to come. Fantastic to see so many of you on the call today. Thank you very much for making the time. I'm still seeing some people showing in the waiting room. Is that right? That's great.
I did have a problem this morning, Hamish getting in, so I don't know if there's a problem with Zoom.
Doesn't seem to be, but that's great. Good. Excellent. Let's give us a couple of more seconds. Somebody let me know when we think everybody's in. I'm going to take the view.
I'd say go ahead, Hamish. I think
Lovely. Yeah, fantastic. So we've got 54 people on the call. That's fantastic. So Borada Pal, good morning, everybody. Thank you so much for joining us for a meeting of the Digital Inclusion Alliance for Wales Network. I really look forward to these meetings. This is the chance really to find out what's going on and to share best practice and innovation across the network. So the fact that you keep coming would suggest that you think it's valuable too, but it's really important, I think, the work of the network. And as you will have spotted, we've been kind of working our way through the different priority areas that we set out in the manifesto, the kind of agenda that we published now about 18 months ago. And we've got, in a slightly roundabout way, we've now got to priority 2. That isn't to say that we've only done one. We've been doing them out of order. And so priority 2 was mainstreaming digital inclusion in health and social care. And we've got a really great agenda, as always. Grateful to colleagues who are going to speak to the network, but importantly, a big chunk of time allocated into breakout groups for you to tell us and tell each other what you're doing, what you think the opportunities are, where you find the barriers to progress, so that we can try and help to unblock some of those. So some of you may know I'm a doctor by background, and health and social care therefore is particularly close to my heart. But it isn't just me, because 52%, I think it is, of the Welsh government's budget goes on health and social care, and it is a thing that impacts really most people at some point in their lives will encounter health and social care, and nearly everybody towards as they get older encounters health and social care. So it's something that's really important, and I just wanted to say a few words kind of just at the beginning of the session today, just to emphasize that point, and maybe to draw out one or two kind of facts to support that assertion. We in our priority area, when we published it, we talked about the importance of there being a chief digital officer for Wales. So I'm just going to update you on a couple of things. So as some of you will probably know, that there is now a chief digital officer for health appointed. They haven't started yet. They were only appointed something like 4 weeks ago, and they're working out a notice period in England. So there will be a chief digital officer for health and social care, and we said in the agenda that we thought that would be a really important role to help from within government and within the NHS Wales executive to really get a focus on digital inclusion. So we're very much looking forward to him taking up post, and early in his appointment we'll be banging on his door to talk to him about this and the work of the network, and in fact the opportunity that the network offers a CDO to have an immediate way of getting a good understanding of what's going on in Wales around digital inclusion. The second thing is that we refer to quite a lot of sort of published documentation, but there is a new digital strategy for health and social care in Wales. In Welsh Government, the Digital Inclusion Alliance were through me, were part of the steering group for that. There were many others, but certainly in its final draft, and it's disappeared now into Welsh Government, and you never quite know what's going to happen when these things come back out again. But in its final draft, digital inclusion is very clearly runs throughout it as an important element of strategy. And again, hopefully that will be helpful to all of you and most importantly, the citizens of Wales, to make sure that it remains at the forefront of people's attention. Just on that, my understanding, we were hoping it would have been published by now. I understand from officials in Welsh Government that actually the Minister is keen that the new Chief Digital Officer has a chance to review it, and to some extent it's a sort of manifesto for them. And that's going to happen, but it's going to happen before they take up post. So there's been authority to share it with them now, and so hopefully fairly soon in the autumn we'll see that published. Like all strategies, it's just a strategy. It doesn't do anything in its own right, but it does give the kind of context within government, which is always very helpful. The work, of course, goes on outside. So why is this priority important, and for whom does it apply? Well, it would be easy just to think, to fall into the trap, I think, of thinking, well, this is about patients and service users of health and social care. And of course it is. But it is also about the staff who work in those organisations. And, you know, the NHS is the largest employer in Wales by some substantial margin. And my old health board, which was ABMU, we had 17,000 staff. Hywel had 13,000. So just for South West Wales, that's 30,000 people just working in health, never mind social care. So, you know, they are a very important constituency for digital inclusion. And I know, because I was the Chief Information Officer, that there are many staff in the NHS who are digitally excluded or digitally not confident. There was a very important survey done by the Royal College of Nursing in the UK, where 20% of nurses said that they didn't feel confident to use the digital tools they had to use in their place of work. Now, that's obviously bad at lots of levels. It's bad for their confidence and their sense of well-being. It's bad for safety, because if they're being asked to use things they're not comfortable with, there's a danger of error. And it's also, of course, a matter of, you know, efficiency. If someone's created a digital tool to do something, if people can't use it, that's not very good. So we must remember staff in all of this. And it is not, you know, this is staff at all levels. And I can tell you of consultants who are not digitally confident. And indeed, I had a chief executive who was digitally excluded in my assessment, had no digital devices of their own, very, very uncomfortable with digital, even, you know, straightforward digital things. Used to get their secretary to type all their own all his emails, for example. And for good measure, was red, green colourblind. So, you know, this is at all levels of the system. And it's important to remember that. So for start, just to quickly start on staff, you know, staff are being asked, mostly in health, but also in social care as well now, to use more and more digital technology in their work. So, for example, for their online and mandatory training, it is online, it's online. You can't do it, not online. And we certainly had big groups of staff in the health board who, first of all, hadn't been given access to a device. There wasn't a computer in their department they could do the learning on. It's not surprising they weren't doing it. But they weren't confident to do even relatively basic digital skills. That became apparent when we were looking into why their rates of completion were so low. There's recently been a Welsh nursing record deployed. So for all the nurses in hospitals using a digital tool now instead of bits of paper. The administrative systems are increasingly digital. There's still a lot of paper in the NHS. I don't get the impression that it's all digital, but there is a lot of administrative systems as well. And, you know, very simple things in those. If you're not confident, people get very anxious that they're going to break something or they're going to lose somebody's record. And you will know if you've engaged with the NHS, just, you know, how sometimes those systems don't work well, and that's partly because part of that comes down to user difficulties. Clinical systems video consulting, of course, was new. It was new for staff like it was new for citizens. And even things as basic as the electronic staff record, which is the least accessible bit of software in the planet. And yet 1.4 million people are supposed to use it across England and Wales. Even just finding out your pay or your pension, any of those things, you have to be digitally included now. You can't get it on paper. And in social care, the Welsh Community Care Information System, which is a sort of shared electronic health record between health and social care, is being rolled out predominantly in social care at the moment, but hopefully soon in health. And again, that's a very different way of working for colleagues who were used to going around with a notebook or a diary and lots of post-it pads and post-its and bits of paper. Suddenly they were being asked to work digitally. They didn't have devices and they didn't always have the skills. So it's a big impact for staff. And then of course for patients and service users, even things as basic, I was very proud that we were the first hospital to have free public Wi-Fi. And this was this came from a conversation with a patient who was having to come to hospital. He had renal failure and he had to come for dialysis 4 times a week. And the dialysis unit was in the basement. It didn't even have a phone signal. And he collared me one day when I was walking by and he said, "Look, couldn't you get me a phone signal? I'm trying to run a business. I've got to employ 10 people and I'm missing for half the week. And I can't even park there." And I said, would it be good if you had Wi-Fi? And he went, "Well, that would be fantastic if Wi-Fi, but let's just start with a phone signal." Actually, it was easier to get Wi-Fi into the hospital. And it was one of probably the best investment we made. It cost very little. And it was had massive use, 15,000 concurrent users at any one time. And it allowed patients to keep in contact with family, and it allowed people to do their work, and it allowed people to find out more about their health condition while in hospital. Really powerful. So there's that, and then, as they say, video consulting now, it came from with COVID. We're about to roll out a whole thing around digital medicines. So you don't need to be digitally included to do this, but actually the process of getting your medicines from the GP is going to change to become digital. As far as the patient's concerned, it probably won't seem very different, but you won't have a paper prescription anymore. It will just be dispensed for you in your local pharmacy digitally. And then things like My Health Online, and just things like health advice as well, being able to find out more about your health condition. There is tons of stuff online. If you're not online, you can't access that. And the evidence that this is important is that there was some very good work done in NHS England. They took 221,000 people, 221,941 to be precise, through a widening participation programme. And at the end of that, where they help people to get online and use being online for their health. Over 40% of people learnt how to access their health information for the first time. 65% of people felt more informed about their health. 50% felt less lonely. And then in real practical terms, 20% of them, or in fact 21%, made fewer calls to the GP as a result of being able to get online and answer some of their questions themselves. In fact, over 90% of those had 3 or more fewer visits to the GP in a 3-month period. 10% of people made fewer calls to 111. 6% of people went less often to the A&E department. And this was estimated to save nearly £6 million, which was £6.40 for every pound they'd invested, something like that. So this is digital is now effectively one of the wider determinants of people's health, along with housing and finances and so on. It's a really important thing, and so we have to, with this increasing move to digital, we have to help people to be able to use those tools, which in many situations are better than the paper analog equivalent, and will become, with all these things like machine learning and AI and helping to give tailored advice to people, it'll become more and more important that people can use these things to get the full benefit for their own well-being, but also for the system. There's a very nice example of how the NHS is working to look at particularly challenged communities. So we know that the people who are most likely to be digitally excluded, and of course you know this very well, are people who are elderly, people who are of poor literacy, people with long-term conditions, and people who are poor. And those, unfortunately, are also the same people who are big users of the health system. So you've got a sort of disproportionate exclusion. The people who really need to be able to do these things are most likely not to be able to. And so there is this concept of the inverse care law that was described 52 years ago in fact in the Upper Avon Valley by a GP, which he said the people who are most likely to need healthcare are the people who find it hardest to access it. And I would suggest to you there is a real risk, if we don't address digital inclusion, that we have a digital equivalent of that. And we'll have the people who most, they'll be the same people really who are left behind. And yet if we do it well, and if we support people to use all these digital things in health and social care, then we could help close that gap, close that inequality gap, because digital can make it easier for people who, for example, live remotely, have poor public transport to get to hospital or get to the GP. They can engage in a different way digitally if we really get it right. And so I'm really passionate that in Wales we really show that we can support patients and service users to use digital tools in health and social care, and also the staff that they engage with. So what's happening in Wales? Well, we're really lucky in Wales. We've got all of you. We've got Digital Communities Wales. We've got hopefully a strategy that's going to commit to the importance of it, and we definitely have ministers who are interested in it. So we're well placed, but individually it's going to be very hard to address this, because there are many people who are not online who use these services, and so the benefit of this network, I hope, is for us to tell each other what people are doing. We know what DCW are doing, and we're working really hard with, for example, Digital Health and Care Wales, which is the sort of digital organisation now for health and social care. And we're very pleased that the chair of that organisation appears very committed to this and is keen that they play their role in supporting the whole system at a sort of system level. So that's probably more than you wanted to hear, but I'll stop there. But hopefully it sets the context of today's conversations, of why it's important. There are things going on. We have some great opportunities, I think, in Wales, but it is so important that we do support people to be digitally included in health and social care, which is why it was one of our priorities. So thank you very much, Sarah. So what I'd like to do now, if I could, is just to ask Gwyneth Jones, who's going to talk to us. Gwyneth is from Pembrokeshire, from PAVS.
Good, thank you very much, Hamish. Jonathan Evans is on the call as well today, so we're just going to share the screen and give you an overview of our project in Pembrokeshire. 6 community connectors are employed by PAVS, Pembrokeshire Association of Voluntary Services. We are community-based, working in the 6 integrated areas of the local health board. Also covering Pembrokeshire, we have a connector for children and families and a development officer for dementia supported communities. They are the solution finders for our Pembrokeshire Community Hub, which started at the start of COVID and continues. And they are the solution finders for the hub, who follow a social prescribing pathway, connecting people to activities and services to improve their well-being. At the start of COVID, we soon realised, when our third sector partners and others acted quickly to put activities online, that most people who could benefit from digital services were the least likely to be online. So we had to consider how we could help those individuals. Various meetings took place with our partners, Pembrokeshire County Council, Hywel Dda Health Board, Public Health, Digital Communities Wales, and our third sector organisations. And we formed a Pembrokeshire Digital Connection Steering Group and a Digital Provider Forum, where we could work together to support those who were isolating, were unpaid carers, lacked motivation and skills, and/or lack of access to the internet and equipment. We received funding from the GP clusters to purchase digital equipment for a loan period. This was a try before you buy period, and the connectors upskilled themselves to offer one-to-one support over the telephone and through WhatsApp to individuals who had never switched on a device before. Connect IT was born. We took on a DigiCoach in Jonathan Evans on the call today to help us with the technical skills, personalising equipment with an email address, setting up apps of interest, a Wi-Fi box if needed, and delivering the equipment to a person's home. John also enabled us to keep track of usage. For instance, we could note if a device had not been switched on. Many a time this was due to forgetting where the on-off button was, or forgetting to charge the device up. A friendly call soon got them using the device again. We encouraged the use of eConsult, My Health Online, and we also took part in a pilot programme with pharmacy delivery drivers who could refer people onto the community connectors by assessing wellbeing needs using a mobile app. I'll just go over to John now, who can give you the technical information.
Morning, everyone. So a couple of years ago, we started looking at various devices in order to get the hardware needed for the project. We settled on Lenovo Android tablets. Not only were they the best value for money, but they kind of ticked the majority of the boxes that we needed software-wise. We did have a few of the My Wi-Fi boxes, but Lenovo also did an LTE version of their tablets, which allowed us to put the SIM card into the tablet itself. That eliminated the need for two devices to be charged. So that was a massive plus. We then provided a case. Initially, we went with 3 as a mobile service provider. Again, for a couple of reasons. We found that they had the easiest package for us to activate and set the SIM cards up ready to use, and they came initially with 25 gigabytes of data, and importantly there was no expiry date on that. We found that other organizations either had a monthly limit or a monthly expiry, for example 6 months and so on. So 3 was the best. We did access some Vodafone SIM cards for those that were in areas that 3 couldn't reach, but in all honesty, 3 has covered pretty much 95% of the areas that we've looked at. Software wise, based on them being Android, we were able to set up a Google Workspace account. So we purchased the domain tablet PAVS.com. And we were able to give everyone an email address, or for those who had access to an email address, we would have added theirs to it. After some research, we came across Manage Engine, which is a third-party platform for managing hardware, which I know a number of you would probably be familiar with. That allowed us to remote manage the tablets. It allowed us to provide support remotely. It allowed us to push out apps, monitor the apps and so on, and also provided another level of security for the users. App wise, we kind of met multiple times as a group and came up with some common apps that we thought users would be interested in, but ultimately we gave them permission to explore and discover new apps via the Play Store should they want, all of which we were able to monitor and support remotely. We initially went down the route of Zoom and then the Google Duo. I think the communication platform is for video calling, but we soon realized that based on the fact that the tablets had the SIM cards in the tablet itself, WhatsApp would work, and we encouraged WhatsApp as the main communication platform, because every tablet had a phone number. Video calling, sending messages and what have you was a lot easier using that, and that proved to be extremely successful. As Gwyneth mentioned then, that the healthcare, there were a number of healthcare apps that we were able to put on the tablets. We were also able to push out some browser URLs, so we were able to add hyperlinks to the screens in order to access websites. Obviously, about 12 months ago, we were able to push out the COVID passes, apps, and what have you, and that's proved to be very supportive and helpful as well. With regards to coverage, we literally do cover all 4 corners of Pembrokeshire. And again, that comes down to the work and the coverage of the connectors. The phone signal is as good as it ever has been, and we're currently looking at 183 devices in and around the county. I've mentioned the Alexas there. We have got a few Alexas that are out in use for those who are either struggling visually or physically to control a tablet. So that takes the device total to hopefully a couple of hundred by the end of this month, or certainly October.
So looking forward, we are working with the Health Board, HEIW Health Board, to raise awareness of digital inclusion and linking into their 8 pillars in preventing ill health, managing their own well-being, and allowing people to live independently through telehealth schemes. HEIW Health Board have also adopted the Elemental Social Prescribing CRM across the 3 counties. So a referral to the community connectors from a GP health professional for local sources of digital support can mean a referral for digital training, or a referral to the Pembrokeshire Digital Data Bank for people who are in data poverty. Consider this a food bank for data. We are extremely grateful to the Good Things Foundation and partners for supporting us with setting this up in Pembrokeshire. We have the cost of living crisis. We are setting up warm rooms in communities. These could be through local parishes, community buildings, and featured digital in its programmes. We have strengths in our communities in terms of people of a retirement age with skills to share, and linked with our digital provider forum who can offer volunteering opportunities. This will increase the offer of one-to-one support to individuals. Using apps for health needs or energy supply can ensure people have information to hand. Using WhatsApp, for instance, can connect people to each other through a local street group, perhaps. And this links to another programme, our Circles of Support programme, where people can look out for each other, and particularly important for health and social care. So as part of our project evidence, we collect most significant change stories, MSc. This is in partnership with Swansea University, led by Nick Andrews. And I'd like to share a couple of stories with you as it demonstrates an actual experience. Normally, an MSc story is written in the person's own words, but this is from one of our connectors and a shortened version for today. The connector had been visiting a lovely woman who borrowed one of our tablets, and she has now bought it. She is a single woman with no children, is a retired nurse, and had never tried any form of computer or tablet or smartphone before. She has terminal cancer, breast cancer that has spread to her bones, which is being held at bay at the moment. She's very reluctant to leave the house because of her immunosuppressant drugs, so she can't go to an IT class to learn. So the community connector has visited her a few times now and has been inspired to try so she could join an online support group for other cancer patients. Plus, she wanted to access online consultations. She has really been enthusiastic to learn, and she picks up everything really quickly. She practices lots, and it has changed her life. She is a really lovely person and such a positive person to be around. She said she has accepted her diagnosis and is making the most of her time. She is a bit of a hoarder, not terrible, but she has lots of boxes piled up, taking up half a sitting room. She said the rest of the house is much worse. The best bits for the connector from this story is that using the jigsaw puzzles and word searches on the tablet has had the unexpected benefit of calming her nerves and has enabled her to sleep better, and even started sorting out her boxes. Scrabble is the next app. She's going to download it herself, as she loves Scrabble. Her eyes light up when she talks about how much she loves the various apps. We have so many stories like this, and it only encourages us to strive to do more. Let's consider what would happen to this individual if she couldn't get online, access a peer support group, access online consultations, use certain apps to calm her nerves, and allow her to build up her confidence to try new apps and to tackle the other worries in her life, such as hoarding. 10 minutes isn't very long to show the achievements of many as they go through their digital journey, but there is no doubt that we hope to continue. Happy to take questions, or if you'd like to put them in the chat, we can respond directly. And thank you very much for the invitation for Jonathan and myself to come along this morning. Thank you.
Thank you.
Thank you both, Gwyneth, Jonathan. That's just fantastic. What great work. Perhaps this is just an opportunity to say that HEIW are now the first health boards to appoint a digital inclusion manager within their own staff, which is is fantastic as well, and it's great to hear you're working together, and I'm sure that person will be of great help to you, your further engagement with them. They are also about to publish an app store for the health board, and if you didn't know that, it would be worth probably just making sure that there's alignment with what you're offering as well, and they can perhaps include that on it as well. We're going to there's an opportunity for some questions after the presentation. So if we could just hold the questions now, there'll probably be lots, I should think, or do put them in the chat, as you say, and then we'll try and pick them up in a moment. So Dewi Smith is going to talk about what's going on up in the north in Bitsy Cadwallader.
Morning, everybody. Hopefully you can see my screen.
We can.
Okay, that's excellent. If I skip that, okie dokie. Yeah, so I've only got one slide, and I might not take the whole 10 minutes. We might make up some time. But yeah, I'm going to briefly talk about Betsy Cadwallader University Health Board's digital strategy. I'm obviously speaking on behalf of DCW here and not on behalf of the health board, but we felt that the strategy took some strides in recognising the importance of digital inclusion in the delivery of kind of wider transformation and the delivery of health and social care services as well. So we wanted to highlight it. So on the slide there, you've got an overview of the strategy. So I'll briefly run through the strategy. And I think it touches on a few of the points that Hamish made at the outset as well. So recognising that a strategy is just a strategy, it's just words until something actually happens and something is delivered. You know, it does create that kind of roadmap and the basis for it. And I think the strategy does it really well, particularly with some of the programs of activity that are planned and some of the stuff that's actually happening now on the ground as well. So yeah, so the strategy has the overarching vision of transforming the patient experience, safety and outcomes through digital ways of working. And the structure, as you can see on the slide there, is with two key ambitions, again, kind of going back to what Hamish mentioned around the national digital strategy for health and social care, looking at the patient and carer side of it, and also looking at the staff side. So under ambition 1, we've got, as a patient or carer, I can use digital technologies to actively manage my own care of others, and to communicate and to have my say on services. On the other side, connected staff. As a member of staff, I can access the right information in the right place at the right time with the right devices, and I'm supported to be confident and to use technology and information to improve the services I provide. Sitting underneath that, you have the 6 enablers, and you know, we were fortunate enough to start engaging with the health board at an early stage in the development of the strategy, which is really good. It was really interesting from our perspective to see how that developed as well, going from those earlier drafts, going through a consultation process and understanding what was important to staff and citizens in general. So initially, I'll come to the digital inclusion enabler in a second, but initially digital inclusion wasn't included as an enabler in the strategy. And the fairly wide consultation, and although the consultation was wide, it did happen during the pandemic, so there were certain limitations. And even then, I'm guessing when it might have been harder to reach those people who are digitally excluded, digital exclusion still came up as one of the top 3 potential barriers to the strategy being enacted. So just considering the enablers, I'll run through them and then I'll talk a little bit more about digital inclusion. So the first enabler is strengthen digital foundation. So again, it's having the networks, devices, hardware systems, storage, etc. Number 2 is around the information. Obviously, data is critical, and we've touched on certain things like patient records, etc. So ensuring that that data is right, it's correct, it's accessible, it's usable, and it's robust. Again, critical to the provision of good healthcare. Enabler 3, a digital organisation, think digital. Now, I think this is probably one of the critical ones, because this does come down to culture, and my colleague Mark always brings out a quote, culture will eat strategy for breakfast, which, you know, there's clearly a big important job to kind of change people's mindset, attitudes to digital, to ensure that people can see the benefits, and obviously that's part of Digital Communities Wales's work. But yeah, Enabler 3 is think digital, being a digital organisation. Enabler 4 is strong partnerships. Again, we saw with Gwyneth and Jonathan's presentation there the importance of those partnerships and sharing information, the role that so many different organisations have, ensuring that people have or are confident in accessing health services, social care services, using digital means, and the support that's needed for them there. We have embracing innovation as well as another enabler, obviously critical when you're talking about implementing and developing any new ways of working, particularly around digital. And then the last one, as I said, was digital inclusion. So yeah, as I mentioned, the consultation really emphasised the importance of digital inclusion and recognised that for both staff and patients and carers as well. So again, going back to a point that Hamish made, you know, having staff who are confident in using digital is critical when you're introducing new systems, and recognising the range of roles within a health board as well, and the fact that some people might not necessarily need to use a digital device on a day-to-day basis. So yeah, just ensuring that everyone has that kind of basic level of digital skills is really important. Again, the rest of the strategy kind of includes a lot of stuff that you'd expect, like the local and national context. There's a really good bit in it in terms of where we are now, where we need to improve, and I feel that was quite an honest assessment of where the health board were and the things that they actually need to do to affect any significant change and obviously enact the strategy. So from our point of view in Digital Communities Wales, again, you know, as I said, we were really pleased that digital inclusion had the prominence that we felt it should have, recognising that it is critical to the delivery of a lot of services digitally. Obviously, we made that point initially. It was really good that that was kind of reinforced by the consultation, and that was picked up. I guess now it's kind of considering the delivery and the action plans which are going to result in these things actually happening. So from our point of view, we've got a few pieces of work ongoing, and I think as well, you know, in terms of the transformation of kind of different models of care, etc., the health board started developing a lot of things during the course of the pandemic, which have obviously continued, such as virtual consultations. I know the work around My Health Online and the new NHS app, which is being rolled out. I know there's quite a few developments in terms of the use of wearables to manage certain health conditions over the course of the pandemic as well. From our point of view, we've got a couple of large pieces of work ongoing with the health board. So recognising the need for staff to be upskilled, we have a memorandum of understanding, ourselves, Unison, and the Estates and Facilities Directorate of the health board. And the aim of that, well, there was a recognition that digital skills were a little bit lower amongst that part of the workforce, just due to the fact that, you know, a lot of those individuals won't be using a digital device on a day-to-day basis. And the issues that Hamish identified as well. So accessing ESR, accessing that mandatory staff training, accessing your pay slips, those things that you know, you have a right to access, and obviously kind of are of particular interest to Unison as well. So we've undertaken a skills audit with about 360 responses to that skills audit from the directorate. We're currently in the process of developing the training program, again trying to overcome those practical challenges of releasing staff and you know, kind of juggling different shift patterns and having sessions on. So we've got quite a significant amount of work set out for the next couple of months to try and deliver to the I think there's about 150 or so members of staff who have expressed an interest in actually accessing training. So we're delighted to be doing that, but again, recognising that that's just the first step. And again, it's about that kind of co-production, co-design, ensuring that, you know, from those organisations working within the community right through the health board, that the kind of levels of digital skills are improved. I think that's about it. If you've got any specific questions about this, we did produce a bit of a blog as well, which was an interview with Andrea Williams, who led on the development of the strategy. Andrea was not available today, but I think she's going to be coming along to the next network meeting as well. So, like I said, she'll be able to give a bit more of an update on maybe some of the other activity that's ongoing. But that's a bit of an overview of the work that we've been doing there. Thank you.
Dewi, thank you very much indeed. Again, just excellent work, and lovely to hear how DCW and our health board are working so effectively together. Just to make an obvious point, you know, giving people in estates and hotel services the digital skills obviously has an impact both in work but also in their own lives, and gives them frankly better career opportunities too. So it's a good thing all round. We're going to move on now to Lee Ballantyne, who's going to update us on the skills audit that is being led by my colleagues in health and health education and improvement Wales.
Good morning, everyone. Can you hear me?
Yes.
Fab. Slideshow. Okay, so I hope you can all see my screen okay. Good morning. It's very cold up here in Scotland this morning, so I hope you can't hear my teeth chattering. I'm based in Scotland, but I work remotely for Health Education and Improvement Wales, which, if you don't know, it's a special authority within NHS Wales, and it sits alongside health boards and trusts and has a leading role in the education, training, development and shaping of the healthcare workforce across Wales. So a little bit of background in healthcare. The digital skills agenda was very much a priority pre-pandemic. We were talking about the fourth industrial revolution and the impact of emerging technologies on healthcare. But over the past 2 years, the adoption of digital technologies has been greatly accelerated by years, because so many organisations were forced to quickly digitise their products and services through the pandemic. And through the course of the pandemic, we've demonstrated unimaginable capacity for rapid transformation, with many long-term plans like telehealth executed in a matter of days or weeks. And these were programs of work that were planned to be rolled out over months or years. But this is not without challenges. Those unable to work, learn, access critical services online, they tend to be people who are already disadvantaged. And so that increased reliance on technology has had a compounding effect on inequality and on health and wellness. And we know that some people in Wales can't or choose not to participate online. We know that the workforce have reported concerns around patients' ability to access digital services. So we absolutely understand that there are gaps. We know that there are issues, and you know, all of these impact the digital capacity and capability of the NHS. They're all related, they're all interdependent, very similar to the enablers we saw in the previous presentation. There's definite overlaps in what we're doing. We fundamentally need access, and by access, I mean both affordability and infrastructure. We need digital professionals, the developers, programmers, data scientists, the people who make and manage our technology. And we need a workforce who can confidently and safely use technology. And we need our patients, our service users, our citizens to be able to use technologies too. So whilst I'm absolutely focused on developing digital capabilities of the healthcare workforce, we need all parts of this puzzle to fully realise the benefits of digital technologies. And those benefits have to be, well, they are tangible offline benefits. You know, we're talking about improved health outcomes, longer life expectancy, decreased loneliness and social isolation, better access to jobs and education, even voice and visibility as we move more of our democratic processes and government services online. And we know that the hardest barrier to overcome, what some people call that third level digital divide, that sense that computers are not for me. Technology and I just don't get on. I only need to look at a computer and it doesn't work. We've all met somebody that's like that. And of course, it becomes self-fulfilling and reinforcing. And research shows that formal interventions just don't reach these groups of people. They don't respond to offers of training. They're not interested. The only support that works is encouragement and help from friends and family. So I like to think that by developing the digital capability of the workforce, that we have a ripple effect into those hard to reach groups in one direction, but also in the other direction, that we might generate pathways towards digital specialisms as well. And to make all of that happen, we need to work in partnership. There has to be cohesiveness. We need to be using the same language and make sure that the work that we are doing is very much aligned and that we're not duplicating or undermining the amazing work that's going on right across Wales. So HEIW has as one of our objectives to lead the development and implementation of a digital capability framework for healthcare. And what that means is that I'm creating a process whereby individuals can better understand the skills and capabilities they need. They can self-evaluate using a tool. They'll then be signposted to resources, and then they will be able to reflect on their progress and their next steps, because I'm really keen that this is it's about empowering people to continually develop their digital skills. It's a continuum. It will evolve. It's not something you do once and that's it, because technology, as you know, is changing all the time, and we need to keep ourselves informed so that we can shape what happens and make good decisions. It's always important to remember that people make technology. It's not some unstoppable force. It's individuals, and people make the policies that impact technology. And so it's really important that we're all informed, we're all empowered, represented, part of the discussion, because you are all the experts at what you do. So therefore, you're best placed to understand and shape how digital works for you. So this is my high-level outline of my approach, and it was really important for me to start with a landscape review. I'm based in Scotland, my background is education, so I had a lot to learn about all the work that was already happening across Wales. And after that, you can see it's very much an iterative approach. I've worked with representation from across the healthcare professions to draft the first version of the framework, which is very much based on existing frameworks. It's not reinventing the wheel. And we looked specifically at the frameworks they were likely to come into contact with. We piloted that after phase 1, and that feedback then informed phase 2, which is where I am now. I'm working with nursing just now to sort of further refine and improve it ahead of a launch, which will probably be October, December time. I've only got 2 phases on that approach, but you know, it's iterative. It will continue to improve over time. So this is, I don't expect you to be able to read this slide, but this is a color coding of the domains used in different digital capability frameworks, ones that I think people are likely to come into contact with. So looking at what's happening in in apprenticeships, in schools, in universities, in other nations. And you can see with the color coding that there is absolutely a convergence. They're all very similar. And even I've got a few of the diagrams that are used on publicity material, and even the diagrams kind of look similar. There's a lot of wheels there. And so it wasn't a stretch to get to this stage of the digital capability framework. We have 6 domains, 3 subdomains in each domain. So for example, in using technology, there's a subdomain foundation skills. And that's where there was a bit of overlap with Digital Communities Wales. So we work together to make sure that we're using the same language and that we're signposting across to each other's work. And this is kind of what it looks like. So what do we mean by foundation skills? Well, we mean can get online, understands the basics, and knows how to get help. This is just one example. And then attached to each of those descriptive statements are a series of capability statements from level 1, which is, you know, I don't really know anything, right through to level 4. I'm really competent and confident, and I can even help others. And the idea is you choose the one that you relate to the most, and at the end of it, you get a personalised report, and then that signposts to more support. So that's where I am. That's my email address. That was a whistle-stop tour of my work. If anyone wants to know more, collaborate, or importantly for this audience, if you have resources that you want to be mapped to the framework and you want me to share across healthcare when we roll this out, then please do get in touch with me and send me through the details. I forgot to move the slide on. That's my email address. So that's me. I think we might have made up a little bit of time. I'm not sure. I wasn't watching the clock very well. But thank you very much for inviting me.
Lee, thank you very much indeed for that excellent overview, and it all ties very nicely together, those presentations today. We have got a little bit of time for question now. Then we're going to break out. We'll shift the breakout a couple of minutes later if we have more questions than we need, that we have time, and then we'll all come back together. So questions for there are a number of comments in the chat. I think everybody is acknowledging just how powerful those presentations were. And Lee, thank you for sharing your email. So I'm sure people may well follow up on that, because it does seem to me it is an opportunity just to align other things that you may not have yet seen. So just for me, you probably know this, but the school's curriculum in Wales for digital has just been completely rewritten by and led by my colleague in the university. So it'd be good to align to the new version rather than whatever, if you haven't seen that. So any questions? If you, probably with this number of people, if you just could pop your hand up, that would be helpful, then I'll see. So can I ask, Dewi, could I ask you a question? So what do you think it was that and I guess it's also a question for Gwyneth in a way, it's kind of, you've both described health boards that have really engaged in digital inclusion, the importance of it. You know, to be completely honest, tens of millions of pounds is being spent on digital in health and social care at the moment. I'm leading a program that I think will probably be 150 million by the time it finishes, for example, for the minister. The business case of that doesn't stack up if most people can't use it. So, there's frankly a financial imperative as well as a sort of moral and social imperative for digital inclusion in these things. What do you think it is that led? Why is it that Halvar and in your case Betsy have kind of engaged with it, and perhaps some other health boards haven't?
Oh, that's quite a difficult one. I think the timing, to a certain extent, in terms of the development of the strategy, it was developed during COVID, and I think COVID, really demonstrated the importance of digital to so many people, and recognizing that innovation through necessity, almost, isn't it? But yeah, I think it was kind of identifying the right people, actually speaking to people who were engaged, who could kind of affect change within the health board, getting those people to recognise the importance. As I mentioned, I think the actual consultation and getting that feedback from staff and citizens was critical, recognising that there are challenges. And I know there's lots of other bits in the strategy as well, kind of around user experience, etc. But yeah, I don't know if that's necessarily answered it. I'll let Gwyneth come in as well.
Yeah. And Gwyneth, when you answer, we have focused in health because that is where most digital stuff is happening. But I'm really keen to hear also about engagement with social care as well.
Yeah, no, I think particularly for us in Pembrokeshire, we had a strong preventions board, and so the line was really to look at activities and services that were reaching people out in the community, that perhaps supported those frequent callers to a GP surgery, and in terms of social care. We set up Community Catalyst project around the same time. So again, it's about the opportunities that are available to people really, and to look at the skilled workforce, and to look at what contribution that can make to the community in terms of setting up micro enterprises. And I think that just all came at the same time. And at the start of COVID, we already had a really strong partnership, and I think that just allowed us to expand and reach out to individuals.
Thank you. And other people, Joe, you've got your hand up. I mean, I've kind of suggested that the other health boards aren't doing anything, and that is, of course, not true. It's just that you've demonstrated a really powerful collaboration to both of you, which is fantastic. Joe, put me right. Tell me that all the health boards are spot on, right on this, are they?
No, not at all. I actually had a question for Gwyneth. You're right. I think that health boards are all at different places. And I think the key thing is finding the right people. Once you can get access the right people to take the agenda forward, it makes it a lot easier. My question to Gwyneth was around interaction with social care. And do you find that one of the barriers is the social care workers not having enough time to actually include digital inclusion, because everything is so governed by, you know, you've got 20 minutes or half an hour to go in and do a certain job with this individual? How do we change that? What needs to happen that we can empower social care workers when they're in homes with individuals to actually be able to have the time to show them how to use digital technology to benefit them?
Yeah, I think the approach has to be with revisiting job descriptions, where digital needs to be a part of that job description, particularly care homes. You know, if we had staff that were trained digitally to support individuals, we would have seen, particularly during COVID, perhaps a better approach in terms of families being able to connect with their loved ones in care homes. Sheltered housing is another one. You know, at the start of COVID, the doors were locked, people had to stay in their rooms, they were told they were vulnerable, whereas actually if staff had been trained digitally, then I think things could have been a little bit better for people. And that's, I know in the health board, they supported patients who were in hospital, but that needs to be mainstream now. And I think that's really about looking at the job descriptions and revisiting the skills that are needed, and digital needs to be there.
Great, thank you.
Thanks very much, Gwyneth and Joe, for the question. There was time for just one question, and it's been going on in the chat, which is about volunteers working in health and social care. It was a question to Lee. Just to add, I suppose, to that question is that health has hundreds of volunteers. I forget how many. I think in my own health, I think we had 1,200 or something. You know, it's a big thing, and in fact, we work with our volunteers, particularly the ones that worked. We rolled out a patient health record. Patients Know Best. I think there are now 10,000 users in Swansea who have access to all their results and letters and things through that. And we actually skilled up some of our volunteers in the outpatient area to help people to be able to set up an email address and signpost them to resources such as, you know, digital equals and so on. So they are a really key group. So Lee, yes, do you want to just extend your answer to that question?
Yeah, so it's an iterative approach, as you saw my presentation, and initially it will be the healthcare workforce for the initial phase of launch. Then we're hoping to extend that to social care, and then hoping to extend it further. So there's two aspects to it. We've got our new platform that we're about to launch. So there's something around licenses and getting people onto that, which would be the perfect scenario. However, to make sure that we are, you know, sharing as widely as possible, I'm absolutely happy to share the framework, all the resources, everything that we have together, you know, openly and widely. So there should be something that is launched on the website at the same time. So if any organisation that's working with volunteers wants to pick it up and run with it and use it themselves, then they'll be able to do that. So there's two aspects. Yes, in the long term, it'd be great to have everyone using the platform, the self-evaluation tool, but in the shorter term, you know, everything will be as open and as widely shared as I can possibly make it happen.
Thanks, Lee. I think volunteers now have some form of contractual. They have to, because of all the various other governance and things. I think actually they do have a contract with the health board of a sort, albeit that they're not paid. and giving them some digital skills will be the health system giving them back something as well. So you know, really good. There's a question from Donna at AbilityNet, which I will ask somebody from DCW, perhaps Sarah, to respond to in the chat. And what I suggest we do is now perhaps go to breakout and continue these conversations in breakout effectively, and we'll see you back after breakout if that's okay. Somebody's in charge of the technology. Excellent.
Hello, hello, can you hear me?
Is being recorded. This meeting is being recorded.
Fantastic. Oh, still more groups coming. Hang on a second. I think we're there. Great. Thank you very much although it's going to be really, we're obviously going to capture some learning from those groups and gather it together. We have got about 4 minutes, just if people have got any questions or burning observations they wanted to make from the breakout groups. Perhaps I just look to breakout group leads, facilitators, anything you particularly wanted to feedback? A highlight from your group? Was tons in mine. Yes, Laura.
Yeah, so one of the main ones from mine, which sort of is all about how we frame this discussion. So so one of the group members mentioned, you know, within the health and social care workforce, if there are potentially older people within the workforce who are a couple of years from retirement, they think, oh, well, what's the point of me doing digital stuff? I'm a couple of years off retirement, why should I care about it? And the thing that really struck me that would help with changing sort of hearts and minds in this way is that even if you're not choosing to do it as a part of your career and a part of, you know, being a part of the workforce, you're still a citizen in Wales and you're still potentially going to be a patient at some point. And if we're looking towards it being sort of technology enabled care, and this is the way that healthcare is going, which it is, you're still going to need those skills, whether you're helping somebody to do it or whether you'll need to do it potentially as a patient on the other, you know, the other side of the coin, really. And I thought that was a really interesting way to look at the shift and changing people's minds. So yeah.
Yeah, exactly. So people have two lives, don't they? They have their work life and their real life, and it's a skill for both that you need for both. Ryan.
Yeah, thank you. We kind of had a similar discussion about, it was kind of culture we were talking about as one of the main things. But before we started talking about health and social care, we had a little chat about kind of reflections from what we were talking about. And Paula at Welsh Water raised something that they do there, which a few people in the group hadn't heard of and thought was really useful. So if it's okay, Paula, would you be able to mention a bit about that? Thank you.
Yeah, so what I was referring to is we do a programme at Welsh Water where we partner with an organisation called Quicksilver. Quicksilver, then we ask for volunteers within Welsh Water, and they kind of help people over the age of 55 with limited or no digital skills. So you get trained as a mentor, you get DBS checked, etc., and you're assigned an individual then to set up perhaps where they're setting up their tablet, an email, a Facebook page. So it's allowing those that have the ability to get connections. And we got involved with Quicksilver through COVID, through the isolation of perhaps those that are a little bit more vulnerable than what they would be if we weren't going through a pandemic. But in terms of it helps people from a development perspective, a career perspective, from able to get involved in doing this kind of extra stuff, if you like. We as an organisation allow our colleagues to have time to do the Quicksilver mentoring, and at the same time enabling some digital skills for those groups over 55.
All of that sounds fantastic. Thank you very much for sharing that. Russell, one thing quickly from you.
Yeah, just quickly, we talked a lot about the successes that people have had within sort of health and social care setting, in terms of stuff that we've done as digital communities, where there's a couple of advisors there, trainers there, but also Donna from AbilityNet talked about gifting some devices to arthritis sufferers up in Wrexham, and getting support from a local volunteer to help them access and get online. So there's a lot of, I think there's a lot of positive stories about where digital can help, and perhaps there's a need to be highlighting and promoting this to get other people to see just what could be done.
Fantastic. Too much in my group to summarize in 30 seconds. We had a very important discussion about the importance of value of Welsh language for a number of users of health and social care, and how we need to make sure that digital services are truly bilingual as a measure of inclusivity, and some fantastic examples, from a number of our group, of stuff that's going on that's really making a difference. So really powerful, really powerful. I would just say, as we end this bit of the session, that every health board has an independent member responsible for digital. And they also have an executive director who has digital in their portfolio, quite often the finance director, but not always. Sometimes it's someone else. And I would encourage organisations that are doing work particularly in geographical areas, to be kind of trying to link into the health board as well, to work together. They don't have a lot of skills around digital inclusion, but they have quite a lot of resource. And so working together, where you bring the expertise and help them deliver their ambitions to make sure their patients and staff are included, is an opportunity, I think. We're going to just, in the closing minutes, we're going to have an announcement from Ofcom. It's always very exciting. And Jenna, I'm kind of assuming that's you, is it? But I don't actually know. Gwyneth, sorry, Gwyneth.
Hi, yeah, I think my colleague Faye will be presenting as well. So I'll pass over to Faye to introduce the project first. Ooh, I don't know if Faye is here.
You're on mute, yeah.
I'm on mute. Sorry. Oh my goodness, that's always the way, isn't it? Especially when you're talking about digital competence. How embarrassing. Really, really thrilled to be joining you today. Thank you so much for having us. It's been so interesting to hear about all of the projects that are happening across health and social care in Wales. I was really keen to join you today because so Gwyneth and I both work on our Making Sense of Media programme at Ofcom. So you might be familiar with the research that we've done across the UK, kind of looking at digital exclusion, digital inclusion, and you may be aware that we're about to take on responsibility for being the online safety regulator across the UK. As part of that, what we want to do is to kind of look into what works in terms of delivering online media literacy interventions. So while that's not exactly the same thing as digital inclusion, you'll recognise that there are overlaps and there are kind of definitely similarities in some of the work that I've heard described today. So we talk about online safety, we know that that encompasses things like misinformation and disinformation, resilience to harmful content online, for example, and you know, especially if you're thinking about this within health and social care setting, we've seen plenty of examples of those being challenging over the last couple of years, especially. So excitingly, we are launching some tenders. So we're really aware that the work that's going on at the moment isn't evenly spread across all kind of aspects of the population or communities. So what we'd like to do is to work with organisations who are able to deliver online media literacy interventions. So this week we will be launching 3 tenders focused on 3 different groups. The groups that we want to work with are the first one is old adults and people at risk of digital exclusion. The second one is people with mental health challenges or disabilities. And the third one is children and young people. So those are 3 separate tenders, but in each case, a very kind of similar approach to the type of work that we're looking for. We're looking for organisations who know those communities brilliantly, who can really well articulate what the need is in those communities and can meet that need as well. Just to layer on top of that, and we've talked a little bit about kind of the, you know, lots of people have been talking about kind of rural areas and financial disadvantage and things like that. We know that financial disadvantage, we see every single time we do our research every year, we see financial disadvantage as a huge indicator in this space. So we will prioritise projects that are being delivered in communities experiencing financial disadvantage. So what I really wanted to come on today to say was just to let you know that this is happening. As I say, the tenders will be out this week. So I'm really happy to send around some documents afterwards and to share my email address in the chat as well. If you'd like to chat to me directly about it, my door is open. Please drop me a line. I'd be more than happy to chat to you about the work that you're doing. And yeah, I'd really encourage you to register onto our e-sourcing portal, which is the best way to kind of get all the notifications about the tender coming out and all the deadlines and things like that. Thank you.
Thank you so much. Well, that's very exciting. So your e-sourcing platform, is that, can you find that through the Ofcom website, or do you want to share? Perhaps you could share the link to that as well.
Yes, yeah, absolutely will do. At the moment, I've got a PDF to share. It's coming onto this is kind of hot off the press stuff, so it's coming onto the Ofcom website shortly. But really happy to share by email afterwards. And as I say, I'll drop my details in the chat. So if you can't find any information about it, please do contact me directly.
Lovely. Well, we'd be happy to share that with all the network members on your behalf, and that's great. And as you probably know, there is work going on in Wales on a minimum digital living standard, which the Alliance are part of, being led by colleagues in Liverpool and Loughborough, and with Compass as well, and that will align quite nicely, I think, with what you're looking at. So
yeah, I hope so. I hope it's really complementary with that work that's already happening. I'm personally a huge fan. My background's in education, so you mentioned the digital framework earlier, Hamish, and I'm really excited to kind of see what impact that makes on Welsh children going through the education system. So it feels like Wales are kind of leading the charge a little bit in this area, so we've got high hopes.
Excellent. Well, that's a good point to stop. In that case, I think that let's end on high hopes. Thank you. It's, as always, the time flies by in these sessions. They're great. There's just so much richness, and you feel there's tons more. So thank you so much to everybody for making the time, for sharing what you're doing, and most importantly for doing what you're doing. We are just we're taking the opportunity to look back at the 5 priority areas that we set before the Senate elections last time, and just to kind of get a sense of what progress is being made. Clearly, it wasn't all for us to do, but it was. We were trying to influence others as well. So we're going to do a bit of a stock take of that, over the next couple of months, and we hope to make our next network meeting an opportunity to sort of present our findings about that and to get your feedback about it. And then just that's an opportunity also to kind of go, well, you know, where does the Alliance go? What's its next thing? Do we just keep on those priorities? Are there other things to consider, and so on? So that, I think, is broadly going to shape our next meeting. Is that right, Sarah? I think so.
Yes,
and great. And so we'll be looking forward to doing that. It seems to me, just superficially, without having done a thorough analysis, there's been a lot of progress in a lot of the areas, and really encouraging, I think, and that's down a lot to you and your colleagues in the network. So thank you so much. So that's it. Next meeting is going to be when, Sarah, roughly?
In December, in the first couple of weeks. Obviously, we don't want to encroach on everyone's Christmases.
Lovely. There you are. So we look forward to seeing you all then. Thank you very much for what you're doing, and do keep sharing with each other outside these meetings, of course, as well, what you're doing, and some helpful stuff in the chat for colleagues. Thanks very much. Nice to see you.
Thank you.